I'm Kath Debreceny. I'm a partner in the corporate and commercial group here at Maddox, and I'm interviewing Catherine Dunlop today. Catherine is a specialist in our occupational health and safety workforce team, and we're going to talk about how people have been managing the COVID crisis. Welcome, Catherine.
Welcome.
So, Catherine, it's been a challenging and a fast-moving time. Could you let us know what the sort of first wave of questions people have had as they've gone into this crisis?
Really varied across organisations. Some organisations and employers were very onto the risk and the crisis early, and they instituted crisis management teams. They thought about how they would have people work remotely where that was possible and what protocols they needed in terms of health and hygiene, and they started communicating with their people about those issues very early. Other organisations, I think, really struggled, and that occasionally happened where people were really struggling with whether this was just a bad flu or something more than that. So there was a catch-up period for those organisations in terms of having to move very, very quickly to what it meant for their business operations and what the risks were. So I think where we are now as a result of that, some organisations are dealing quite well with the fact that they are in new arrangements, and some I think are still catching up to some extent and adjusting to what is a new normal, and that it's normal, which is likely to be in place for some time.
Okay, and so for those firms that did prepare things early, how are they dealing with it now that the change has happened and people are actually working from home, or in the cases of businesses that are still open, working in a very unusual way where there might be only half the people that they would usually be with?
I think the more lead time organisations had in, the more they were able to think about the IT issues and make sure they had appropriate infrastructure, but also prepare their people and talk about how they would work and have those conversations. Some organisations have had people working remotely for many years, and they deal with that very well, and they know that it's a different skill to manage people working remotely, and you need different ways of communicating. Other organisations have had to learn that, and most organisations I'm dealing with have picked that up really quickly. So we have got used very quickly to the idea that we can have people working remotely, and that in a health and safety sense has meant that we now need to start looking at some of the other risks that perhaps we didn't have a chance to look at initially. So what are the mental health and safety risks that we need to deal with? Because we've got some people who are in public facing roles who are very nervous about the risk to them, but other people who are working in a very isolated environment, home office or stuck away in some corner of their house. We have some people who are still working with a laptop on an ironing board because that's all they have. And so those issues about ergonomics and those sorts of things, at the start it was just getting people to be able to work, but now that we know that people are going to be working remotely wherever possible for as long as we expect, now that we know from National Cabinet that is going to happen for some considerable time, we are now moving into a world where we need to start thinking about what is the safest way we can have people working, both in terms of their physical health and safety and mental health and safety. So it really is a time now to transition from what has been a temporary arrangement to thinking, well, this is going to continue for some months, so we need to reassess this.
So, Catherine, if people are now working as usual, working from home, are you seeing claims coming in now? And if not now, are you expecting to see them shortly?
I am. We've seen some come in already, and I think we will see more. Some will be a little opportunistic. Some will be people who are genuinely unwell or injured because of the circumstances of them working. And we only need to know from people who are on constant video conferences. We talk to people and they talk about a feeling of fatigue and exhaustion. Some people are struggling with mental health issues and really finding it difficult, particularly for those people who are exhausted because they are trying to homeschool around normal working hours, and for whatever reason, flexibility hasn't been considered or isn't appropriate in those circumstances. And we also know that from just speaking to people on video conferences, they stretch, they say how sore they are, people are sitting more, they're not necessarily in appropriate chairs, they're not necessarily working with appropriate sized monitors. And I think we're starting to see in the guidance coming through from Safe Work Australia that we need to reconsider those issues and make sure that people do actually have a safe place to work that's appropriately set up. If we think about what we expect in a typical office environment or in a typical workplace in terms of the facilities that are available and the equipment that's available, If we're going to be working in a different environment or a changed environment for months, then we need to make some attempt to replicate that in order to stop claims coming through.
So it appears that we may be seeing some loosening of restrictions coming in the next couple of weeks or at least a month. As people move to transitioning away from this new normal at home to be back into the office, what sort of issues are going to arise for people there and managing?
I'll start off by saying there's an enormous amount of good material on the Safe Work Australia website, which is sorted by sector. And so I really encourage organisations to go on that and have a look, because you will find a lot of very, very good guidance material. Having said that, it can be overwhelming knowing where to start. The first thing I think organisations need to get their head across is that issues about access into workplaces, how many people can be in a space, how they're going to get there, need to be thought about first. So if you are working in an office environment and you use lifts, how many people can get into the lifts? And if only 1 or 2 can get in, you can't have, for many cases, your normal workforce returning to the workplace. So access and physical distancing within your workspace to some extent will determine how many people can come in. And that's the same for manufacturing and the same for retail and for a range of other sectors. So you need to do some of that planning first. Then you need to think about, do you want people in? Do you need people in? Are you going to ask people to come in? Many people won't want to get on public transport and come into work because they think, I can do it happily and healthily and safely at home and I don't want to come in. And we now know that they can work well in that environment. So we will move to having a split environment with people working in different places, and we need to adjust how we deal with that. Then there's all the issues about how you manage health and hygiene in the workplace and protocols for cleaning, what to do in the event of a suspected infection, how to advise people. And again, Safe Work Australia's got lots of great material on that. What I think organisations really need to be doing, though, is to have a plan, a timed plan for what they're considering and when. They need to remember that under health and safety legislation and work health and safety legislation, you need to consult with your workers. So if you've got a health and safety committee, you use that. If you don't, it's an opportune time to really touch base, speak to your people, speak to health and safety reps, put surveys out, ask some quizzes, ask people what they think and seek their feedback, and realise that you're not going to have a situation where you suddenly say on day one, 80% of the workplace are coming in, because unless you have a very unusual workplace, you won't be able to put them back into the normal working environment. So the second part of it is communicating that to people, managing expectations and talking about the fact that this is going to go for several more months, possibly until the end of the year. We just don't know. So managing people's expectations around that's really important. The third thing I think is to have an appropriate mental health plan, and we've helped clients develop something really simple about what we expect from the HR and P&C function and what we expect from leaders. Mental health is going to be a really, really huge issue for many organisations. The evidence suggests that if people are going to fall in this environment, they will fall fast and they will fall quickly, and there will be a huge impact on individuals and their families and their friends and their colleagues. So having an appropriate mental health plan which tries to destigmatise mental health issues, encourage people to speak up, give them access to resources, and then provide for them to deal with issues in a way where the employer responds compassionately, deals with it, and tries to help the employer recover as quickly as possible is going to be really, really important. Mental health and safety is tricky because people feel often unable to know how to have a conversation about those issues, particularly because sometimes the way mental health presents is someone is just not doing their work very well. So we need to be getting better and more mature at having a conversation that says, how are you going? I notice you struggling. What can we do? Can you go and see your GP? I think you need some help. There is nothing wrong with that. And being able to have that conversation really comfortably is something that many people find difficult. So now is the time to invest in a bit of planning and a bit of training for leaders on those issues.
So that sounds like a challenging time for businesses and for people alike. I guess any time invested now will save people heartache, time and money in the future. Thanks very much. It sounds like there's a lot for you, keep you busy in the next couple of months, and stay safe, and we'll see you soon.
Stay safe, Kath. Cheers. Bye.